feeling. You just know that something's not right, that person's not right, there's something going on. And as the drugs campaign say, just say no, just say to them, I'm sorry, but I don't wish to treat. It's not like the NHS. You don't have to treat them. It's, you know, if you're doing this, it's a private business. It's within your rights to say, I'm sorry, but I don't wish to treat you. You know, it's not people turning up on there. And if you do get that gut feeling, and I promise you, so many doctors and nurses have said to me, I knew there was something, I really didn't have a good feeling about this. You know, typical cases, you know, someone coming in and they, you know, and they said to me, oh, she's very flighty and everything else. And I know she was going on holiday to Spain 2 days later. And basically she gave her a chemical pill, knowing that this woman wouldn't follow the post-treatment that, you know, she promised she'd put her hat on and she'd put the creams on and stay away from the sun. What she did, she went out there and straight away, no hat, no nothing, skin just reacted. And, you know, she should have just said, I'll do it when you get back from holiday. But the temptation when you're first setting up and getting going is to chase the buck. You know, think, oh, I must get some money in. But I would just say, a bit of caution. If anything triggers anything and your gut's telling you no, honestly, it's probably the best practice, because when we look at the claims, there's not many claims, but there's a lot more sort of, if you like, dissatisfactions and other incidents which are never dealt with as claims. But if some of these sort of pointers gives you the confidence to say, no, I'm not going to do that. You know, my job's been well done today. Again, test patching and etc. Again, dermatologically, you'll be used to doing all that. It's amazing how quickly people forget to start doing that. You know, when it's coming to chemical peels and etc., they just want to do the treatment as quickly as possible, get them out, etc. But really, where there's good practice, you should stick to that. And as I say, you know, you're fully aware of that from, you know, your own professional background, the importance of this. But it's amazing how often those are sort of overlooked. And again, keeping full notes. The important thing is that with consent forms, etc., and with aesthetics, you're really saying to them, you know, that medicine is not an exact science. I can't guarantee you the results. You know, it's nothing in medicine is exact. And therefore, it's important that consent forms are signed, post-treatment forms are signed for it, and that you keep a full note of the medical record, and that you know, the client was happy, came back, did their consultations, etc. But if they fail to attend a post-treatment, do chase them. Just, you know, you want to do your review. If should ever anything come to a claim, it's important that you have seen to follow professional grounds, and that you've done everything possible, they've signed everything. And as I say, in many cases what we suggest is that you take a picture pre and post the first treatment. We don't say every time they come back for a treatment that you need to do it. But so you've got a base record of where they are to where they are. And obviously if there is a reaction, take a photograph. It used to be difficult, but nowadays with camera phones and all the rest of it, it's very easy to keep those records. But it's extremely important if you're trying to defend your case that everything is signed, sealed and settled, and they've consented to the treatment and have known, you know, the contraindications at their post-treatment plan, and that they were aware of the results. Because if you get a man like this come in, you've got to manage his expectations. I mean, you know, there are people who come in all the time. Their idea of looking 10 years younger is completely different to what you're looking at them and thinking. And poor old Brad, he just can't look this good. And you've got to manage that within him.